What's happening at the ankle? I'm in. What? Dorsiflexion. Folks, don't forget gravity, but don't forget closed kinematic chains. For me to be upright, I know my head isn't nailed to anything. So it's not an engineer's closed kinematic chain, but it's a functional one. If I keep my head upright, which my brain wants to do, my brain wants to have its windows level, or at least its vision level. I got a new pair of glasses by an optician who didn't know what she was doing. She assumed I was normal. I'm not. If you look at me closely, you'll see one pupil sits lower than the other. When they make glasses, especially now that I've got bifocals, they got to take that into account. I started getting headaches after glasses. The other thing I noticed was I could see better out my rearview mirror than I could see forward. It dawned on me, she did it. The old days, you could see where those little bifocals are. Now you can't see them. She didn't take that into account. I'm having to change my whole kinematic chain to get my vision level. Okay, so iliopsoas. What will the psoas major do that the iliacus can't? They both attach to the lesser tubercle, right? So it must be the other end. What's the difference in the attachment?
The psoas is on the spine.
So it can
Lateral flex.
lateral flex. The two of them together can bring the lumbar spine anteriorly, which we would call flexion. When you get into the back, though, you're going to make a discovery. It works in a closed kinematic chain. So when you start using the iliopsoas to pull the lumbar spine anteriorly, you're going to see some extension up here. Hence the back pain. Hence, tight hip flexors have great clinical implications. My first action in anybody with back pain, other than I ask them, okay, where is it? When does it happen? Makes a heck of a lot of difference if it's in the morning or in the afternoon or at night. That's beyond where we are right now. But I do what's called the Thomas test to distinguish what might be tight at the hip. Okay, the knee. Any questions about what we just talked about?